Have you ever been absolutely terrified? One of the scariest moments of my life was being told that my son had to have surgery on his stomach. I can tell you this because at the age of 3 weeks, my son was diagnosed with pyloric stenosis. This topic relates to all of you because some of you may have children, some of you may want children, and it's always good to be aware of childhood illnesses. The purpose of my speech is to inform the audience about the disease pyloric stenosis. I will tell you the cause, the effects, and the cures of this disease. First, I will tell you about the condition itself. The definition of pyloric stenosis, according to Mayo Clinic, is an uncommon condition affecting the opening between the stomach and small intestine, or pylorus, in infants. The opening narrows due to a thickening of the muscle of the pylorus, and food cannot pass through to the intestine. While the exact cause of the thickening is unknown, doctors believe that it can be linked to both genetic and environmental factors, such as antibiotics ingested by the mother during gestation, or there could be a family history of the defect. Next, I want to tell you about the effects that pyloric stenosis has on the body. Because the food cannot pass through the pylorus into the intestine and digest properly, vomiting is the main symptom of pyloric stenosis. Due to the persistent and sometimes projectile vomiting, the child may become dehydrated. As stated in the article, The Endangering but Treatable Pyloric Stenosis, the most dangerous part of the condition isn't the vomiting, but the dehydration that occurs due to it. Failure to gain weight and lethargy are also complications brought on due to dehydration. Because the main symptoms of pyloric stenosis are very similar to those of gastrointestinal reflux disease, also known as GERD, it is often misdiagnosed. Correct diagnosis is a key factor in proper treatment. In order to diagnose the patient, a doctor will begin with a simple abdominal exam and sometimes will feel an olive-shaped lump because of the swelling. If the physical exam suggests pyloric stenosis, the doctor will order a barium swallow, which is a procedure in which the baby must swallow a small amount of chalky liquid, and the special x-rays are taken to detect whether there is a blockage or not. Instead of a barium swallow, the doctor might perform an ultrasound to detect the blockage. Blood tests are often recommended to test the levels of electrolytes and nutrients because the vomiting may produce abnormalities in those levels, and IV fluids may need to be administered and to determine the correct form of treatment for the patient. There are two types of treatment for pyloric stenosis. The first is a liquid medication. This treatment is used to treat mild cases of the disease found at birth. The other is a surgical procedure called a pyloromyotomy, in which the surgeon cuts a small passage through the thickened muscle of the pylorus, opening a pathway for food to pass through and be digested. According to kidshealth.com, pyloric stenosis should not recur after the surgery has been performed. While children who develop pyloric stenosis are in fact at risk of death due to dehydration and malnutrition, this condition can be treated and does have a cure. In summary, my speech today was to inform my audience about the uncommon disease pyloric stenosis. I have described the disease, the effects it has on the body, treatments, and cures. My own son was diagnosed with the condition when he was only 3 weeks old. Being informed about childhood illness is always good because some of you have children and some of you may want to have children someday. I would like to thank you all for your time and attention today, and I hope you all learned something from me.